Hey, welcome everybody. I'm Brad Lucas, Chief Medical Officer at Buckeye, and really happy to have a moment with all of you and with some of my team. This is something that's probably overdue, and we've been excited to think this through and work on it for a little while now. So now with no further ado, I'm going to go ahead and get started. I want to begin by, can we advance the slide? We're here we collected questions from staff, and I think you'll get a sense that we are answering the questions that were asked, and I just really appreciate the time spent and any time spent giving us a listen. So I'm going to introduce you to the team. I'm going to start with Dr. Blanda to give a little hello.
Hello, I'm Dr. Michelle Blanda. I'm a practicing emergency physician. I've had the pleasure to work with many of you during my 4 years here at Buckeye. And for those of you who have worked with me, you know I'm fairly direct, straightforward. I like to get the job done, and I'm willing to do the work that it takes to accomplish that. I've worked in busy EDs all my career. I've worked at academic teaching facilities, community hospitals, and rural hospitals. I have firsthand experience at COVID as I have been on the front lines during the pandemic.
Thank you. And Dr. Lehner, say hello.
Good morning. Tom Lehner. I'm medical director for long-term care for Buckeye. I've been here for about 3 years. It's been a pleasure working with all of you. And although I can't see you, but you can see me. Now you can put a face with the name. My specialty is long-term care, although I'm boarded in family medicine. But for the last 10 years, I've done mostly long-term care. So I've been on the front lines and seeing a lot of the effects of the virus that we're going to discuss today. And it's a pleasure to be here with you.
Thank you. And Dr. McCluskey.
Hi, I have worked for Buckeye for 11 years and everyone enjoyable. My background includes family medicine for 40 years. I have also been a public health commissioner for the city of Akron for 2 decades, on and off. And also I worked for First Energy Corporation as their COVID czar, so to speak, to mitigate, to look at testing and to look at vaccinations and encourage them. And after all of that conclusions, I've come to believe that we're on a mission from above to save our country and save our citizens. I do not like the fact that over 700,000 people have died. That's all preventable. But at any rate, we're here to answer your questions.
Okay, thank you all. So let's get right to it. Let's get, I think, to a question that we've all asked right from the very beginning is, what is the COVID vaccine? What is mRNA? And how is this different from vaccines we've probably all had in the past? Dr. Blanda?
So the slide we have is from the CDC, and it shows how the mRNA vaccine works. Remember, the mRNA vaccine is given in your upper arm muscle, and it basically gives instructions or directions to your cells, to the muscle cells. And it tells those cells to make a protein piece that looks very much like the protein on the coronavirus. And this protein piece then on your cells stimulates your immune system, which kind of recognizes these proteins as being abnormal, and your body's immune system starts to make antibodies to them. And this would be similar to what would happen if you had a natural infection against COVID. And it's very important, though, to know that that mRNA envelope and the protein piece that is made get destroyed within a short period of time. And in the end, what happens is your body is protected against infections in the future. And this mRNA vaccine, like all vaccines, allows people to get protection without ever having the risk of the serious complications that come from coronavirus.
Thank you. Dr. Lehner, anything to add? I don't know, thinking of other vaccines in the past, or how difference?
Well, this vaccine, was brought out by virtue of this COVID pandemic. But the technology's been in development for quite a long time, so it's not a brand new technology, and we know that it's effective. And the vaccine was developed to protect us from not just getting the virus, but if you happen to get the virus after you're vaccinated, it protects you from being sick, prevents you from being in the hospital, prevents you from being on a ventilator, and ultimately prevents you from dying. And what we've seen is exactly that. This vaccine is doing its job. It's protecting those people from ending up in the hospital with a serious illness. It also prevents from the long COVID illnesses that occur after the virus occurs. So this vaccine is very effective, and it's not a brand new technology. It's been around a long time.
So that does get into the, another common question is, what about the quickness, the speed of the development that it became available? Reason for concern there, Dr. McCluskey?
Well, as Dr. Lerner said, this has been in development since the 90s. So we have to appreciate the fact that this is not a 6-month to 18-month development period of time. To develop it specific to the COVID vaccine, yes, it was on the shelf. They took it off the shelf. They began to manipulate, get the proper protein attached to the virus and to the mRNA and how that works. And it's just brilliant how they were able to do that. But that's the value of that research going on all the time. And it has been since the 90s and our SARS epidemic. And I would just like to expand, Dr. Lucas used a term this morning when we were prepping. There is a vacuum cleaner in our bodies that cleans up all of those leftover parts once it has been made a vaccine and it dies. Other vaccines die, it cleans it up, and it is not there after a short period of time, as Dr. Blanda said. And then the vacuum cleaner takes it to an incinerator, gone.
That's taking me back to medical school. What do we call that vacuum cleaner?
We call it a macrophage.
Macrophage. Okay, thanks.
Yeah, it's the garbage disposal of our.
Thanks so much. Let's continue with some of the questions that came from the staff that are kind of a little bit along the lines. What about me as an individual? And specifically, we had a question. I work remotely, and I know others do as well, since we've shut down the Cincinnati and Miami offices. Many of us are not in physical contact with members, providers, and employees. Since the Delta variant has spread, the effectiveness of the vaccine has dropped significantly. How can we state that this mandate is to protect those who cannot be vaccinated when we are not necessarily protecting ourselves or others from the virus? And then another question, kind of along those lines, with hospital systems making it mandatory for their medical staff to take the vaccine, why is there now a shortage in the medical community due to nurses and doctors not wanting to take the vaccine? So, Dr. Lehner, you have dialogue with your patients. Are these questions that you hear, and how does that conversation go?
Yeah, I have had this question, not just from patients, but also from residents or from staff at that work at the nursing homes. Why do I need the vaccine? And it's a good question, because if you're working remote, you would think, well, I'm not going to be exposed to anybody. Why would I get the vaccine? The answer is you need to protect yourself. This vaccine, first of all, the virus isn't selective. It doesn't pick and choose who it infects. And as Dr. Bland has attested to, she's seen a lot of carnage in the emergency rooms from people that come in from the public that are sick. The vaccine protects us from the virus. It also protects us from infecting others, because when we're infected, we're shedding virus. So whether you're working remote at home by yourself or you're working in an office, it protects you from getting the vaccine. It also protects you from spreading it. You think about the fact that you're going to go to family gatherings, you're going to go to church, you're going to do other social things, and it protects you from catching the virus from somebody else in one of those social settings. It also protects you and your family from you, should you get infected and you're shedding the virus and them catching it from you. So this is about all of us making sure we're protected and safe, but also protecting those that we associate with, and then those we live with and those we love. So the vaccine's very effective that way. And that's why, even if you're not working in a big office setting like we used to pre-COVID, it's really important to make sure that you're protected, so you're protecting those that you live with and those around you.
Thanks. Thanks, Dr. Lehner. Yeah, as I know, as we're going through this year and last year, there's been over 20,000 studies looking at this from every different way. And when we think of effectiveness and the activity. And an actual question is, well, how long is it effective? What's going to be the course of this virus and how it works? So can we state how long it lasts at all? What are thoughts around there, Dr. McCluskey?
Well, the experts do not know how long the vaccine lasts. Most vaccines that have been developed through the previous to mRNA have a waning period. And remember, those are egg-based production. This vaccine is not egg-based production, so we don't see the side effects. But as far as it's lasting, we're seeing that as they monitor titers, as they've given the vaccine during the research, that there is a fall off, still protected, but there's a fall off in the level of protection after about 6 months. For healthy people, they have determined that it's still plenty effective. For older persons, over 65, who are immune compromised, like myself, I've had a kidney transplant twice and I'm on immune suppressed meds. I ran to the store to get my virus because I needed to be protected. And it was interesting, the third shot I got, finally I got some symptoms like a sore arm, a little fever, a little sweaty. And I was so excited to get that because that means I was getting immunized and I was getting a response.
Hey, Dr. McCluskey, thank you. Dr. Lehner, anything to follow along there with duration of effectiveness or what's happening there?
Well, as Dr. McCluskey said, even if there's waning immunity, it doesn't mean no immunity. It means that we're still protected from the virus. And what we do know is, and it's not unusual to get a booster. We get a flu shot every year. Part of that's because the virus does mutate and change. Part of that is because we lose some immunity from year to year from the flu vaccine the year prior. So you also get it when you get your hepatitis series, you get several boosters. And there are other vaccines, tetanus shots. If you're out raking leaves and you cut yourself, you're going to get a tetanus shot if you haven't had one in a designated period of time of about 10 years. So boosters aren't unique to immunizations. And as we know, our bodies change and the virus can change. Now, currently, the booster is recommended by the experts because of those factors. So the booster shouldn't alarm anybody. It's not because it's not effective. If this has been a very effective vaccine, probably 90 to 95% effective, most flu vaccines, they estimate 40 to 50% efficacy as far as being protected from influenza. So when you're talking about 90 to 95% efficacy, it's pretty good for a vaccine.
Thank you. Yeah, I heard it described the other day as we all continue to ask questions and read. This is science in action. We're figuring it out now as quickly as we can. I think it's along the lines of the booster. Another thing that was really described is I promise, we have an open, transparent country here in terms of the science and the academics. There's not another country where with our FDA, the CDC, the transcriptions are all available, meetings are available to listen to. They have forums where any stakeholder can go in and have free time to talk and share their opinions. There's a level that just doesn't exist anywhere else. And that's how we know about the FDA discussions just recently, just in August, when there was a FDA approval for the booster and the conversations they went through. The first question was, should there be a booster for everybody at this point in time? And that was not approved for everybody. They looked at and realized the folks who had already been vaccinated were only having mild disease after that. So there was not a reason for a booster at that point. That may change. They went right back in the room and talked about the second issue and said, well, what about the booster for age 65 and above, those who are immunocompromised or really in a setting where they're at risk for having severe COVID-19, and the booster is, that's the recommendation, FDA approval right now for the booster for those folks, and we'll see how things go. All right, thank you. Well, let's, another question we received, people who are vaccinated are still transmitting the virus. So why do I need the vaccine? Dr. Lehner, can you help us here?
Sure. So if you've received the vaccine, you can still get the virus. And if you're infected with the virus, you're still shedding. Even though you're vaccinated, you can also still get the virus even if you're vaccinated. So the idea is that we need to protect ourselves, as I said before, and protect the people that we work with, live with, and associate with. So the vaccine, people that have been vaccinated and get the virus, they are typically not as ill and don't end up in the hospital, don't end up on a ventilator, and don't end up in a casket. So the real idea here is that whether you're vaccination is the way out of this situation we're in. It's a safe vaccine and it's effective. And so even though if you get the virus, vaccine rather, and then you get vaccinated and you get sick, you're going to be still shedding, but not shedding to the same degree than an unvaccinated person. So you're less infective, you're less of a vector, but you can still spread the virus. And so you're not going to be as sick if you happen to get the virus after a vaccination, but you're still offering protection to those around you as well.
Okay. Hey, thank you. Thank you very much. I'm going to ask some questions of the panel that are going away from those themes of safety and the individual's role in prevention. How safe do you feel the vaccine is for children? I know I hear it is safe, but do you really know what will happen 10 or more years down the line? Children still have a lot of living to do. Dr. Lehner, what would you like to share?
I would just start off by saying we have to fight the battle that we're in. And right now we are seeing a second surge of this virus, perhaps the third if you don't count the very first when all this started. So the vaccination is important. Secondly, what we're seeing is, especially with this current Delta surge, when schools are open and we're seeing more kids be infected and get sick with this virus. When the kids get sick, they're just like an adult. They become vectors, they are shedding virus, and they can infect their family members, grandparents, other students, parents, etc. So the importance of the vaccine can't be understated. Is it safe for children? Yes, as far as we know, it is safe for children. We don't know what's going to happen 10 years from now, but I would emphasize the fact that we need to fight the fight we're fighting today. And right now we're looking at a very, very serious virus that creates very serious infection and potentially fatal in some people. So the vaccination is really important. And it's important to vaccinate our children because our children can be vectors just like an adult and spread it around.
Oh, thanks, Dr. Lehner. And yeah, that's certainly a concern we always have about what are we protecting future generations. And I think we can take away the idea that we feel like the material of the vaccine is being taken away, and we don't have a vaccine out there that's been developed in the past that posed long-term harm. If a person has COVID, how long do they have to wait to get the vaccination once they've recovered? And I'm gonna take this one and answer. We've discussed it, and we certainly have some what I would consider specialists in our panel here. We've heard plenty that certainly 1 to 2 months later, as long as you're not acutely ill, you can get the vaccine. We've heard, and I think it's reasonable too, as much as 4 to 6 weeks. You just can't be ill following that infection. You can get the flu vaccine and the COVID vaccine at the same time if you're not sick. Something else to point out, if you have been treated with a monoclonal antibody, then you got to wait 90 days to get that vaccine. Otherwise, that vaccine is not going to work at all because of the treatment that you had. Okay, another question. If I had COVID and have natural immunity, why do I need the vaccine? And I'm going to answer this one too. And that we can't quantitate natural immunity yet. We don't know. It's still being sorted out. We do know that those who were immunized, they're not showing up at the hospital, and they're not the ones in the ICU. So I think it's protecting yourself and your family, friends, colleagues, community from being in the ICU. Is the vaccination safe for individuals who develop epilepsy? Dr. Blanda, I'm going to hand this one over to you.
Okay, Brad, thanks. Before I go on to talk about the epilepsy, people who have had COVID, who then it is recommended that they get the vaccine. Many times that is number one, to protect you from getting it again. And number two, for protecting you from having long-term symptoms. So it is shown that people who get the vaccine after they have COVID have less long-term effects of COVID and are more unlikely to have post-COVID syndrome. In regards to seizures, people who have seizures are able to take the vaccine. The reason seizures were of concern is that both the vaccine and COVID can cause fever, and fever in itself can lower seizure threshold, making you more susceptible to seizure. So fever should be addressed by the use of acetaminophen or ibuprofen, but the vaccine itself does not cause seizure.
That was an interesting point I hadn't thought of. And we know that, and I didn't know why, but that helps. Epilepsy is one of those ones that puts you at risk for severe COVID. It was also pointed out in some of our research and discussions that there's not an illness that's a contraindication in getting this vaccine. Are you able to contract the virus again if you already had it? And if so, will it be more severe? Dr. Lehner, I'm going to hand off to you.
Yeah, actually, you can get it. I've had it twice. I had the astute honor of having it 2 times. Once before the vaccine and once just after I had the first shot. In fact, the day I got the shot was probably the day I was exposed, frankly. So yes, you can get it twice. But it's very different. It depends, I think, on viral load, depends upon how the virus affects you. My symptoms were different both times. And both times I was pretty sick. So you can get it twice. But I've had the vaccine and I haven't, despite I haven't changed, I'm always very cautious, but I still go to work every day and I still go to do my long-term care rounds, and I've been exposed to people that I know have had it, despite I'm protected, and I've not incurred another infection. So yes, you can get it twice. There's no guarantee the second or first infection will be different than the other.
Thank you. And I had a thought that left me, and it's going to come back to me. But as we heard long haul a few times already today, and again, speaking to somebody who's had infection, what do you say about the long haul? What does that mean here? What does that play in?
Well, long COVID or the long haulers is a term that refers to people that have had symptoms beyond the infection for 4 weeks. So, and there's 2 categories from there. There's the subacute group, where they've had infection or symptoms post-infection between 4 and 12 weeks. And then they've got symptoms beyond 12 weeks. It's called the chronic COVID syndrome. The treatment for that is basically a multiple disciplinary approach, but the symptoms are lasting. And at this point, we don't know how long they last. Sometimes they resolve with treatments, and there are a variety of treatments. Sometimes they do not. But again, it's too early to tell about some of those things.
Thank you. I had something on my mind, and I'll just wait and see if it comes back to me. Thank you, Dr. Lehner. Here's another question. What is the difference between the Comirnaty COVID-19 vaccine that was approved by FDA by Pfizer and COVID-19 vaccine that Pfizer has been distributing to people in the United States? We just want to share it. It's the same thing. It's kind of, they have given it a name. It was FDA approved. Now it can have a brand name and not so much a generic name. So same thing. And we have a little quote here that is on the Pfizer website in their press release saying it's the same thing. Another question. The packaging the vaccine comes in does not list the ingredients. What are the ingredients to COVID-19? And I'll take this question too. We're going to share some links to the CDC link that has frequently asked questions. And they have the links in there for each of the manufacturers, each of the vaccines that goes to, and it takes you to all the ingredients for each vaccine. And I think we have a slide that does show the ingredients. And I assure you, there is a package insert and it looks like all package inserts. If you need more, you want to see one of those inserts or see what that looks like, well, I'll have you just reach out to me. So there were some questions that were more specific to the treatment of patients who are in the ICU and their lungs are not working. And what I'm going to suggest is please reach out to one of the medical directors or myself individually to ask some of those questions. We also want to answer those questions, but wanted to focus more here on the vaccine and prevention. Bottom line is, the ICU is not a place you want to find yourself or your family or your friends. In the ICU, they are working hard to get patients' lungs oxygenated because the lungs, they don't want to work anymore. So,
Hey, Brad, can I make a quick comment?
you can, yeah.
So with regard to the hospital situation now, and you've probably all heard this, but I participate in a couple of zone calls across the state on a weekly basis. And what we're seeing is the vast majority of hospitalized patients are unvaccinated, younger patients. So again, underscoring the need for the vaccine. We're not seeing as many vaccinated patients that are ill. And the ones that are the sickest are also the ones that are on ventilators and needing life support. And they are typically unvaccinated younger patients, meaning 30s, 40s, 50s. And those are the ones that are dying. So what we're not seeing are what we saw the first time around, which was we had elderly, north of 65, north of 60 from long-term care or from the community. We're not seeing that group of people at this point in time in the hospital to the same number because they've all been vaccinated. So again, it really underscores the benefit of the vaccine and that it is doing its job and it's protecting people. Thanks, Brad.
Thanks, Tom. I might have skipped over it, but I think we had a comment in here about possibly preparing for a family pregnancy or if somebody might be pregnant, what about concerns they would have? And I'm just going to share two thoughts here. One is anybody that I'm an obstetrician, and at some point in your career and your training, whether you're a medical student or a resident, you're used to having generally healthy folks as your patients. You're ready for all the things that can happen. But everybody goes through rounds at some point, and you go up to the ICU and you see a pregnant patient that you're rounding on, and you're told they got the flu, they have pneumonia. And it is really bad to get the flu when you're pregnant, and pneumonia when you're pregnant is really bad. And no surprise that pneumonia related to coronavirus, lung problems related to coronavirus when you're pregnant are really bad. We know that there's an individual at Summa Hospital who's pregnant who may not make it. Another story I heard is one of my dear colleagues back at corporate, who's a clinician, who's actually a pulmonary specialist, and he's kind of semi-retired. So he spends a lot of time actually listening to FDA meetings and reading up on this and kind of knows things that are coming out to the public before most people know. And he's shared a lot of information across Centene. And he shared with me yesterday, there's data that's not yet published from the UK, and 20% of all of the patients on ECMO, that means extracorporeal, means your blood is going out of your body to get oxygenated and then coming back in. We usually think of babies as being on ECMO. But 20% of all of the patients in the UK on ECMO are pregnant patients. So that's, we all, ACOG, the experts are recommending the vaccine in pregnancy. Thank you. We've spent time, talking about concerns and safety, and I'm going to go back to everybody. We're wrapping up a little bit here. What is the one thing each of you would tell a friend or family member about the safety of the vaccine? And I'm going to I feel like there's a lot of things we wanted to share. We wouldn't fit everything in, and two things I've heard recently. One, I had a, if you peel everything away, the vaccine, it's designed to prevent funerals. That kind of captures it. And then everybody's got lots of friends and family on different sides of this issue, and lots of family and friend conversations. And one of my real dear friends, he said, I don't get it. Why do you care if I get my vaccine? And I just said, I texted, I said, Henry, I just don't want you to die. And I hope that I don't, that's what I was feeling at that time. So now I'm going to go along, and Dr. McCluskey, what would you share here to kind of finish up with us?
Well, I've been looking at some of the questions that were question and answers that are being presented as we're live. And I want to let anybody who has one of those questions, at the end, we will supply you with a way to contact us to be able to answer those questions or give us an opportunity to. One thing that I'd like to tell folks is media has a way of sensationalizing this, that, and the other thing. I look at CDC reports, MMR, morbidity, mortality report, Summit County report every week. I get a full report, and to have some of the facts that are in question, such as the vaccine side effects are killing 2 to 1 people over natural disease. It's just not true. I have looked, we look every time, and it's not, I don't believe it's true, and I can't find anything in the scientific literature to validate it. Given that point, I also have a daughter who's a pediatric intensivist, and children in West Virginia, in Morgantown, are getting the disease. They are dying. They are very, very sick. And a vaccine, I believe, will protect those kids from a very preventable disease, just as whooping cough used to kill babies and we could do nothing about it. But nowadays we have a vaccine and it's almost gone away. And the last thing that I would say is, somebody said in our presentation, we have to treat the war that's in front of us, and it is a war. This vaccine is not going to go away like other diseases. I'm sorry, the vaccine is not going to go away. The disease is not going to go away. But the way the vaccine's been developed is it is turning and remaining that capsid, and it's not having to do anything with the virus. It's still going to kill no matter how many times it mutates. But when it does, they're on it and be able to develop, just as they do every year, an adjustment with the flu vaccine. So I've not seen a vaccine death in any children, but I have seen vaccine deaths. Now, I have seen COVID deaths with unvaccinated persons, and you just got to look at the data.
Thanks, Dr. McCluskey.
I could go on another 20 minutes, but
yeah, this is what we do. Yeah. Hey, Dr. Jawad could not join us. We were going to have him, and I'll tell you, he puts a lot of this so well. He really does. He's shared things that were really effective, but better than I can share. One, I did want to, we haven't spoken about the Delta virus. I did want to share, he describes it as the unvaccinated population serves as a reservoir for the virus. That reservoir allows for mutations. And if we don't get to a point where that reservoir goes away, there's plenty of opportunity for mutations, and that's obviously a danger. Tom, Dr. Lehner, I'm gonna ask you for some final thoughts.
Sure. I just wanted to go just a little bit over real quick, a little bit more about the long COVID. There are some risk factors for the post-COVID or long COVID syndrome. Female gender, early shortness of breath, and 5 of the initial symptoms. And the initial symptoms, as you probably remember, are cough, shortness of breath, fever, chills, loss of taste and smell, GI distress. With this Delta, we've seen a lot more GI distress than we did with the first go around. Excuse me, myalgia and sore throat. And the virus, in and of itself, the infection is bad enough. But what really makes this virus more virulent is with the damage that it does. It's an inflammatory response that the body uses to defend itself. In so doing, that's where the damage occurs. The inflammation that the virus creates the damage. So the other risk factors include, again, an elevated D-dimer, which you probably know about that, but also more than 5 of the initial symptoms starting out. So those people are at risk. And really what we're seeing is people that have heart trouble, chest pain, myocarditis, shortness of breath, fatigue, palpitations, tachycardia. It also affects the lungs or the pulmonary system with shortness of breath and a chronic cough. The neurological symptoms are also more prevalent than almost any of the viruses we've seen that we typically see. Cognitive impairment or the foggy brain type syndrome, general fatigue or chronic fatigue syndrome, chronic headaches, depression, anxiety. And I just read an article this week that talks about how much more depression and anxiety we're seeing in people post-COVID that didn't have that as a underlying diagnosis or comorbidity prior to the infection. And then anosmia, persistent loss of taste and loss of smell. I know some people that have had this for coming up on a year. In fact, I talked to a nurse over the weekend who had COVID a year ago in November, and she had it pretty severely. Didn't end up in the hospital, but she was pretty sick at home for about 2.5 weeks, and she's just now getting her smell back. But she said the problem, taste and smell back, but the problem is everything she eats tastes like garlic. And she said it's horrible, so she doesn't eat. So, and I had, one of my symptoms was no smell, no taste. I lost about 10 pounds because I just don't have any ambition to eat. She still feels that way. So these long haul effects are very serious. And, you know, we often don't know how they last, and there's really not a real remedy for this at this point in time, although we know it's a multidisciplinary approach. So what would I say to my family? I do work in long-term care, and one of the things that's indelibly marked in my head, in my mind, is what happened last fall. So, Chris, you know, the surge, it started right around Thanksgiving here in Northern Ohio last year, went through about mid-January. I probably saw, I know one of the buildings I work at as an attending physician, 35 patients died. And many of those people weren't sick to start with. They were, and some were on the road to recovery, and then suddenly just died. So 35 people out of 110 in that building lost their lives. What we're seeing now is we're not seeing the extent of those people in long-term care get the illness and die. They may get sick, but most of them survive. And the ones that don't usually have another chronic illness. So the vaccine is effective. And when I tell that story, it impacts people that I talk to, because it does show the vaccine is working and it's effective. And we really haven't seen the deaths and the all the trauma that goes with that since with this current surge. So the vaccine is effective. It's doing what we had hoped it would do, which is what we've said all through this discussion is it keeps you out of the hospital, it keeps you off a ventilator, and keeps you alive. So I'm a advocate for the vaccine, and I hope you all appreciate our perspective here.
Thank you, Dr. Lehner. I know that in some of our discussions, and it's not unusual to turn back and look back at other vaccines that have come along over the years. And we were going to share a video. We did not get through the technical part far enough ahead of time, but Dr. Lehner had shared about a physician talking really spectacularly about his journey, and at some point he says, you know, I don't have polio, I don't have smallpox, and he showed in his arm where he got the smallpox inoculation vaccine, and he was, you know, we all don't remember that, but we all know we got that. Dr. Blanda, I'm gonna turn it over to you.
Well, I do want to make the comment that, you know, it is our goal and Centene's goal to try to follow the public health guidelines and to keep everyone safe. And so that is the intention of talking about the vaccine and having the vaccine required. There was a comment about that people were dying 2 to 1 due to vaccine injury. And that statement is not correct. In the United States, more than 350 million doses as of August have been given. They do monitor deaths. They do that through the Vaccine Adverse Event Reporting System. And the death report was 0.0019%. So that is not accurate statement. There was also a statement about countries stopping vaccines. There was a hold in Europe on the AstraZeneca vaccine in the springtime, but it was not saying that no one should get the vaccine. It was a hold because of side effects. So they are monitoring side effects. As an emergency physician, as someone who works in the front line, I've seen the toll of COVID-19. I've seen the toll it's taken on everyone. I've seen it on myself, the fear of going to work, the loss of the joy of my work. I've seen the toll on my coworkers and the healthcare team that I work with, as we just continually get barraged with patients with no end in sight and no place to put people. And I've seen it in the patients and their families as they struggle to breathe, their fear, their confusion that has occurred. I have seen patients die. I've seen them suffer, and I've seen them have long-acting symptoms. And it's my hope, and I think it's the hope of this team, that the information that we presented to you today is of help to you, help you spread information that is factual and to help you make decisions. So we do thank you for your time.
Thank you, Dr. Blanda. We've finished up, and I believe we have one more slide which has contact information. We'll certainly make the slides available and continue to kind of help everybody out as a team. We were excited to just kind of all be together with Buckeye, with our team, and spend this time. So just thank you so much, and we're going to sign off, and everybody enjoy your day.